Welcome to Oncology Data Advisor. Today we're here live at the ASCO annual meeting in Chicago, and I'm joined by Dr. Morana Vojnic, who is one of our editorial board members. Thanks so much for coming on today.
It's a pleasure to be here. Nice seeing you again, Kira.
You too. It's great after doing, some Zoom interviews over the last few months. It's great to do an in-person one.
Finally meeting each other in person. That's very exciting always.
Very exciting. To start off, would you like to introduce yourself and share a little bit about what you do?
So I'm a medical oncologist at Northwell at Lenox Hill Hospital. I see primarily patients with neuro-oncological diseases, so primary brain tumors, secondary brain tumors, as well as thoracic oncology. And I'm excited to be here at ASCO again.
Yes, definitely. How have you been enjoying it so far?
Oh, ASCO is always so fun because you actually get to see people you haven't seen in like a whole year in person, except just communicating through email. So it's always very exciting catching up and seeing the new data, honestly, and how the field is going to move forward, even if there's no new approvals, maybe how the field is going to move forward. So it's always a very exciting time of the year for me.
It definitely is. Speaking of which, have you seen any important updates in brain tumor or brain metastases research so far this year?
I think the oral abstract session that is going to be on Monday, it's going to be very important. Perhaps not phase 3 trial results, but there's going to be a lot of phase 2 and a lot of perhaps initial trials with some exciting data and with the hopes of moving the field forward. Also, the poster session for the CNS, the central nervous system tumor that is ongoing right now. It has some very interesting work from a lot of different institutions throughout the world. But going back to the oral abstract session, I think the update from GBM AGILE with one of their agents is going to be important. In addition to that, there is also a whole session in the oral abstract section where they're going to be discussing targeted therapy mainly for recurrent glioblastomas and for our MGMT unmethylated glioblastoma, for which our standard of care, really, the temozolomide, provides minimal overall survival benefit. So now there are several trials, it seems like, ongoing where they're trying to substitute the standard of care with another agent, perhaps more targeted therapy. And while the data is still early that's going to be presented, I think it's pretty exciting for the future. Also, there is some work and using of CAR-T in recurrent CNS lymphomas that is going to be presented, which also is very exciting because that's another very, in our field, a lot of the neuro-oncological diseases in the recurrent setting especially are hard to manage because the standard of care is not really there. So having any data that is moving the needle forward is it's terrific to see.
So some really exciting updates. Yeah. Are any of these things that you plan on either incorporating to practice or telling your patients about?
So none of these things are so advanced in clinical trials that there would be an approval for it. But for sure, on the off-label setting, especially for my recurrent glioblastoma setting, for my recurrent glioblastoma patients, being able to use an off-label agent, perhaps, for more targeted therapy where there is some response seen. That's somewhere where I definitely plan to discuss with the patients. But I'm also very excited to see how this is going to move forward in clinical trials and also giving more options for patients for clinical trials as more trials open. I think a lot of the things are still early stage, but just seeing the future move there is very promising.
Absolutely. So as the research progresses, is there anything you're most looking forward to seeing in the field in the next few years?
I think in the field for the recurrent glioblastomas, I would definitely try. I'm excited to see the future where we would have more of a standard of care, even in the recurrent setting. So just having all these clinical trials ongoing, even in the early stages, for patients, giving them alternatives, I think that's very important. In addition to that, there's also some very interesting brain metastasis data presented where they're adding this new device called TTF, which is actually approved for glioblastoma, in addition to just giving SRS, and it's showing benefits in terms of overall survival. So I think all of these things, as they gain approval or as they gain more patients to actually have validated phase 3 data, I think that will definitely change the field and our standard of care. But from my perspective, really, the recurrent setting is where we need to work a lot on.
Absolutely. Since yesterday was the last day of Brain Tumor Awareness Month, Go Gray in May, we did the interview earlier in May with Dr. Matt Hadfield, Dr. Jethro Hu, to discuss some of the updates in the field that have occurred. Do you have any closing thoughts from the month that you'd like to share with the audience?
For the month, I would say May is always an important month for brain tumor awareness because it's Brain Tumor Awareness Month. But also, I feel like a lot of the patients and their caregivers get, I would not say the courage, but I think a lot of them start speaking out this month because they feel it's okay and it's appropriate. And I just want to say, well, there's only one Brain Tumor Awareness Month a year. Feel free to speak out anytime you want and reach out anytime you want, because speaking out, it's extremely important just to raise awareness amongst everybody, because this can happen to anybody. And just knowing that there is a whole community out there, not only of physicians and researchers and providers, medical providers in general, but also patients, caregivers, acquaintances that has dealt with or has been touched by this disease in some sort of way, shape, or form is extremely important. So just feel free to speak up and keep talking and keep raising awareness throughout the year.
It's a great message. Awesome. As we wrap up, anything else you'd like to mention either about your ASCO experience or brain tumor research in general?
Brain tumor research, as we said in our podcast with Dr. Jethro and Matt, is really, I think the future is bright. I think it's going to take a bit of a longer time to get there, but it's exciting that so many people are working on a lot of different things. We are working on a lot of different things. There are a lot of other institutions are working on a lot of different things just to give more options. So in general, that's where the passion for a lot of providers lies, and I think having hopes for the future is important.
Absolutely. Amazing. Well, thanks so much for stopping by today. It was great to hear about this research and all the things to look forward to in the future.